Yeah, Chainsaw Bear. They complain about lower back pain, but the lumbar spine is completely clear. It's the Sacroiliac Joint, the SI ring. Time to run the Laslett Cluster 5 provocation tests. Let's go!
Is it the spine or the sacroiliac ring? Run the Laslett Cluster, see what the symptoms bring.
Distraction, compression, thigh and sacral thrust. Gaenslen's dropping the leg, turning pathology to dust.
Find the pain, isolate the pelvic floor. 3 out of 5 positives, knocking down the door.
Start them on their back, supine on the bed.
SI.
Distraction, messing with their head. Cross your arms, push down on the ASIS. Gaping the anterior ring, causing the stress. Stretching the ligaments, looking for the sign. Now roll them on the side, walking the clinical line. Side. Compression, pushing down on the crest. Crushing the posterior ring, putting them to the test. Beat it up. Beat it up.
Now roll them back over. Thigh thrust is the move. Posterior shear, making them jump out the groove. Flex the hip to 90, push down through the bone. Hand under the sacrum, hearing the patient groan. Sharing the ilium right off the sacral base. The most sensitive test, winning the clinical race. Now flip them on the stomach, laying flat on the zone. Sacral thrust, baby, pushing straight on the bone. Springing the sacrum, pushing anterior down. Testing the whole joint, taking the pelvic crown.
One more to go. Gaenslen's on the edge, drop one leg off the table. Stepping off the legs, flex the other knee, push it deep to the chest. Torsion on the pelvis, beating out all the rest. Twisting the SI joint, pulling it apart. Finding the true lesion, treating the patient's heart. So how do we score it?
What is the master key? Out of the 5 tests,
You gotta give me a positive signs and the diagnosis is clear.
SI joint dysfunction.
Destroying the clinical fear.
Is it the spine or the sacroiliac ring? Run the Laslett Cluster, see what the symptoms bring.
Distraction, compression, thigh and sacral thrust. Gaenslen's dropping the leg, turning pathology to dust.
Find the pain, isolate the pelvic floor. 3 out of 5 positives, knocking down the door.
Distraction.
Compression, compression thigh thrust. Gaenslen,
You got 5 out of 5.
don't confuse it with a lumbar disc.
Laslett Cluster,
Chainsaw Bear,
anatomy Lindy. Got the racehorse here.
we out.